Calgary-Varisity.
Thank you, Mr. Speaker. In my constituency of Calgary-Varisity, we have a lot of seniors, and they're paying a lot of attention to how our government supports long-term care choices. They're also watching to make sure that the right amount of funding reaches seniors who need it. My question is to the Minister of Health. You've received many questions today, and I will ask one that drills a little deeper. How are recent changes to the patient care funding model in Alberta impacting residents of long-term care facilities?
Honourable Minister of Health.
Question. Well, Mr. Speaker, I thank the honourable member for an insightful question. As honourable members may know, patient care-based funding has been around in Alberta since 2009. It is based on the principle of matching funding for a particular patient to that patient's needs. Mr. Speaker, this principle has seen funding increase to a number of long-term care facilities across the province over the last year. Adjustments are also made in the case where funding exceeds patient needs. And, Mr. Speaker, this is one of the ways that we attempt to deliver a patient-focused continuing care system.
Thank you, Honourable Minister. Honourable Member.
To the same Minister. Given that long-term care partners like Bethany Care Society have indicated that funding allotted through the recently revised AHS funding model is not adequate to provide care for seniors with dementia, will you look again at the funding model with our partners and iron out those difficulties?
Thank you. Honourable Minister.
Well, thank you, Mr. Speaker. Another very insightful question, and the answer, of course, unlike a number of others that have been asked earlier today, and the answer, of course, is yes, Mr. Speaker. We're working with individual providers. As I said earlier, as patient needs increase, according to this model, funding increases, and as patient needs decrease, funding is adjusted accordingly. That can have an impact on staffing levels at various times during the year. We'll continue to work with our partners, Mr. Speaker, to make sure that we mitigate the effects.
Honourable Minister. Honourable Member.
Thank you, Mr. Speaker. Again to the Minister of Health. Given that providing compassionate end-of-life care is becoming more prominent in the mission of long-term care providers, has AHS considered allocating more funding towards these services?
Honourable Minister.
Well, Mr. Speaker, the answer is yes. And unlike other questions that we heard earlier today that focused on particular types of beds or types of institutions, the question of how we support Albertans in end-of-life care is very important. That's why, Mr. Speaker, Alberta Health Services is making investments in that area. It is why we will have a very important policy discussion in this province next year about the continuing care system and how we care for those needs as well as those for Albertans living independently. Thank you, Mr. Speaker.